Now, whether we like it or not, dementia is on the increase, and relating to the thought processes of someone with dementia is, well, very, very difficult. So how can we know how to live with and care for a person with dementia? How about a virtual dementia tour? I've been to Halstead to experience one.
He's standing in the middle of the room.
So he's not moving at all, he's just standing there.
Completely immobilized. And again, that's typical dementia, where they'll just stand in the middle of the room, and you can see that he's trying to listen to the sounds that are going through his head, but he can't make sense out of them, so he doesn't know what he's supposed to do. And standing in the middle of the floor is the only thing he knows to do.
Although it affects more than 800,000 people in the UK, it's also one of the most difficult conditions for those who don't have it to understand. Well, a virtual dementia tour is being used at a care home in Halstead. It's designed to give carers there and also family members the chance, if you like, to walk in the shoes of someone with dementia. Well, at the end of last week, I went along and I took the tour myself. I was guided through it by its creator, PK Beville.
So the first thing that we're going to do is we're going to take your shoes off and put these bumpy pads in the bottom of your shoes so that you can feel what it might be like to have peripheral neuropathy.
And what's that?
That is a disease that's in the extremities of people who are aging, and it feels like pins and needles in your fingers and your feet. So it makes it kind of hard to move around. That's why you see that shuffling gait.
Okay, and then what?
And then we're going to put gloves on your hands to simulate what it might be like to have arthritis. So often in people's hands and feet, they have trouble picking things up and feeling things well.
And then the glasses. Tell me about the glasses.
Okay, the glasses are specially made for simulation of brain deterioration as it relates to vision. So as people begin to age, they lose the ability to see through clear lens, and they see through a yellowish-orangish haze. So we've done that. We've also limited the peripheral vision by not allowing you to see to the left and right, which is also a part of cognitive decline, so that it makes it harder for them to know what's coming to the left or the right. We also gave you a little bit of macular degeneration so that you're seeing through a tunnel, so it's harder for you to make sense out of the environment.
And then the headphones. Now, they were most unpleasant.
Yes, well, they're designed to be that way because we want to mimic the chatter that people with dementia are experiencing. So it's hard for them to decide what they're supposed to do that's being given to them auditorially, visually, by another person because of the sounds that are going on in their heads. So since they can't do that, we find them wandering around and pacing and having difficulty.
Right, well, I've actually done this before, but I couldn't do the interview with you while I was going through that. So take me through what I went through before.
You were given a set of preset specified tasks by one of my colleagues. And when my colleague read to you those tasks, she was standing right in front of you so that it was very clear that you could see you were supposed to do something. In fact, you said out loud, "I can see your lips moving, but I can't understand anything you're saying. You could be singing." Perfect, spot on for dementia. That's exactly what they feel. Then you were left in that room completely alone. There was an observer in there who observed every single thing you did and tabulated that. But while you were in the room, you were left to your own devices, which is a scary kind of a thing because you don't know what to do.
And I found a bed in the room. I found all sorts of things on the bed. I had no idea what I was supposed to be doing because, as you said, I'd been given instructions, but I hadn't got a clue what those instructions were. I had no idea. I was just completely confused about the whole thing. So to start with, I just lay down on the bed.
And that's exactly what a lot of people do with dementia. And so they give up. They just lay down, they don't want to move, and when people try to intervene, they're very entrenched in their what we call the Alzheimer's bubble, and they don't want to get up, and then they lay there, they deteriorate, get more confused, and then it's over.
And as I was laying there, again, I was getting more and more agitated, and I thought, I've got to do something. So I found some socks on the bed. I tried to put the socks together, but I couldn't see them properly, so I couldn't match the socks up, which was frustrating. I saw some towels on the bed. Well, I thought I'd fold them, but I still hadn't got a clue what I was supposed to be doing.
But that's exactly what we want you to do, because you did exactly what dementia does. That they get into a room, they're not sure what they're supposed to do. They know they have to do something, and the worst part is, no matter how hard anybody tries, they're just not going to understand it. That tells us how important it is for those of us who are caring for people who have this disease in the home or in a care home, that we have to do the things for them. We have to open the blinds. We've got to keep them moving. We've got to talk to them. We've got to encourage them. We've got to show them visual cues and verbal cues. We have to take our time as much as we can. And we also want to help them see, do you want to wear this shirt? Great, I'm going to help you put it on, rather than go find a shirt and put it on. So there's a big difference.
Well, that comes back to what I found on the bed, because everything on the bed was incredibly confusing for me, because I could hardly see it. I didn't know what I was supposed to do. I didn't know what it was there for. It was a mess anyway, because it was just thrown on the bed. So again, it would have been easier for me if things had been tidier.
Sure. And they will try to make order out of chaos, people with dementia. So you see them wandering around everywhere trying to make things fit in their brain.
And all the time that this was going on, this ghastly noise. Can you just describe the noise and why you use that noise?
Sure. We took a white noise background, and then we took a radio station off the channel just a little bit so you could hear people chuckling and laughing and talking, but we elongated some of the consonants and the vowels so that it was hard to put it all together, because so frequently people with dementia have so many sounds going on in their head that they think that's what they're supposed to be paying attention to. So they head off in another direction and we never know why. Or they hear the television in the background and they think, well, that's talking to me, because those sounds are so hard. We also had in the sound some startle responses, because they have a difficult time weeding out what they're supposed to do versus what they're not supposed to do. So if a phone rings, they'll stop everything they're doing and go answer that phone. Or if a doorbell rings, they won't answer the door because they're not sure what that means. So you see, so we put some of those in there as well.
It's a very interesting tour. How is it going to help?
I don't think we can help anyone unless we take a minute to walk in their shoes. And dementia is one of the only things that we can't walk in. We can all identify with young children. We can identify sometimes with people who are divorced, have had cancer, all of those issues. But dementia, we can't do it. So it's critical, if we're going to treat the over 1 million people in England that are suffering terribly from this disease with very little or no help, and the whole community is struck and they don't know what to do. Going through a simulation like this will give people ideas of, okay, well, while I was in the tour, this would have helped me, so this is what I need to do here. If I'm gonna try to work with a care staff, then I'm gonna help them make a leap between the specific residents that they're caring for and how they went through the tour and did the exact same thing, so what would have helped? And then from that launches them into care plans that are more appropriate to dementia, rather than medicating them and actually making them worse.
How do you see the future of this? How do you see the future of our treatment of dementia?
Well, I think we're standing at a tipping point right now where a lot of dollars are being put towards research into a cure. That's discouraging right now, because being around 30 years serving this population, there have been a lot of exciting things that have been on the horizon that have fallen flat and cost a lot of research dollars. So I believe that the future is in the here and now, that until there's a cure, and that's quite a ways off, I don't even think we're unlocking the key quite yet, we're going to have to deal with the people as they are now. So to me, the future is helping people understand what to do today in our banks, in our grocery stores, in our decisions about care, and quit waiting for some pill that's going to cure people.
Now, I couldn't take my microphone in with me when I was doing it myself, because it just wouldn't have given you anything, because quite frankly, I was so confused by the whole thing, I didn't know whether I was coming or going. We'll do that in a short time. I was inside the room with the tour's creator, PK Beville.
So we are going to stand back out of the way and where we can observe them. And what's interesting is we're now standing in front of one of the doors that they actually could go through to finish 2 of the tasks. So if we see them moving in this direction, we'll duck out of the way so that they can see if they can complete the task. Interestingly enough, we've found that one of the things with dementia is the loss of secondary process thinking, which means that they can't abstractly think. So if a dish or their prescriptions or something like that is behind a cupboard or in a cabinet, they're not going to know to go get it because there's no visual cue. So one of the tasks is in a closet back here that it's a wardrobe though that sticks out very well to the normal eye, and you would naturally know to go there to get this task. But in the case of dementia here, you can see that they're not even going to broach the threshold.
Oh, here they go. They're coming in. Right.
So they're being read the task.
Find the white sweater and put it on. Write 3-sentence notes.
And as he's reading it directly in front of the participant. He's not touching the participant at all because we don't want to give any kind of a tactile cue to the person that's simulating dementia.
So he doesn't know what's going on either. He didn't hear any of that, did he?
No, but he could tell that he stood there quietly trying to listen to the task. So he tried to assimilate the information and he couldn't do it. He's standing in the middle of the room. He's not responding to any stimuli much.
So he's not moving at all. He's just standing there.
Completely immobilized. And again, that's typical dementia where they'll just stand in the middle of the room and you can't imagine why in the world they would be doing that. But he's immobilized by the disease right now. You can see that he's trying to listen to the sounds that are going through his head, but he can't make sense out of them. So he doesn't know what he's supposed to do. And standing in the middle of the floor is the only thing he knows to do. So someone either has to come rescue him and give him something to do, or he will just stand there for the entire time for the tour.
Right, his feet have moved once. Now, your assistant is doing what now?
She's going up and she's reinforcing him and telling him that he can look around the room and see if he finds something that makes sense to do. So basically, we've given an auditory cue to fight the headphones and given him a task that's kind of difficult still to interpret.
Right, his colleague is coming in now.
Right, and now a second person is going through the tour and getting read a different set of tasks to do so that they can compete with one another, but it always throws the first person off that a second person's in the room. But we have to do that because dementia rarely lives alone. There's usually somebody around. He's whistling, which is a typical dementia behavior where they do something under their breath. That's a subvocalization. He's gone right to work at the bed trying to make some socks. And the other gentleman is doing what we call shadowing. He's following him. The first gentleman is following him over to the bed to see if something over there makes sense for him to do. The siren just went off in one of their headphones, and they're kind of getting a little bit agitated with one another. One of them is being agitated, and the other one doesn't quite know how to handle that.
The second one just hit the first one.
Yes, he did. Yes, he did. Inability to reason through behavior is sometimes difficult, so we just kind of ignore it as long as we can.
And these are not the tasks they've been set, are they?
Oh, no, they're not the tasks they've been set to do, and even better than that, they've both vehemently decided what they're going to do on the bed, and we're probably going to get into some agitation. And that's very typical with dementia. When we have several dementia patients all together trying to do what they think is right done, they get very protective of what they're doing, and that's where some of the agitation and difficult behaviors occur. So now one of them has gone about the business of folding all the towels on the bed. They're going about the business of organizing the whole bed. So see, they're making order out of chaos, which is so classic. And that's something that we should all do to help dementia, is give them things that they can do that are tasks from their past. Folding is an easy thing for them to do, and they don't have to actually feel it. And there goes the whistling. So that's obviously his coping strategy. He's talking out loud.
He's doing a lot of humming now, isn't he, the second child?
Sure, and that's so aggravating for family members and staff members frequently, but it's very classic, and they're supposed to do that.
But the first chap is he's virtually immobile still, isn't he?
Yeah, he's having a tough time. He's breathing very deeply, and he's sub-vocalizing, find the belt, and he's actually looking right at the belt, but he's not making a move towards it. And the first gentleman is going back and cleaning up what the second gentleman left undone on the bed.
The second gentleman went straight into action when he came in here, but now he's stopped. And the first gentleman, who was very immobile to start with, is now doing a lot more.
Exactly, and that's the exciting part about dementia, isn't it? Because they still have their personalities, and they still have the things that they do in their own mind to make sense, and but still they're both within the confines of the disease. Now, one of them has found the belt that the other one wants, so he's taken it away from him, and he's going to make that work. But actually, the task was to find the belt, put it through the belt loops, and put it on the bed, but he's found the belt and just, with a great deal of self-importance, placed it on the bed. He's very proud of himself. Now, my colleague came in and told the first gentleman that his time is up. He looks very relieved, and he's being led out of the room. The second gentleman still has time left.
And he's gone completely immobile from being a whirling dervish to start with. He was loads and loads of action. He is now just standing there.
He's run out of gas, and which is a seed to depression. He started out feeling like he might be able to handle this, and the realization is hitting him that, in fact, he's not been able to. So that's a real seed to depression that we have to make sure that we keep him active, keep him involved, keep him that whirling dervish, keep giving him things that he actually can do, minimize his distraction level, and encourage and support him.
And I did ask PK Beville what sort of research she'd done into whether this was realistic. And just to repeat what she said she asked a lot of people who were in the early stages of dementia what they were feeling, what they were hearing, what they were seeing, what they were feeling, what was going through their minds and so on. And then she gave them a little taste of the tour, and they said, yeah, that's it, that's exactly what I'm doing. So that was just part of her research. But how did it make me feel? Absolutely appalling. It was awful. I can tell you, it was absolutely awful. And the worst thing was this constant noise in the ears, and I just couldn't think of anything. I couldn't process any instructions. I didn't know what was going on. It's the Dave Monk programme, BBC Essex. Yeah, if you feel able to discuss dementia and how it's affected your family, and if you are or were the carer, how did you cope with that? Would a course like the one I went on help? Because it certainly opened my eyes in a very big way, I can tell you that.